welcome to the next episode of MedEd Matters. It's great to be back. I'm your host, Dr. Omar Young. I am joined again by my colleague, Dr. Avi Sripad. How are you, Dr. Sripad?
Doing well. How are you?
I'm awesome. We have a really interesting episode for you all today. We are recording this about a week after the residency match, so congratulations to all of our new incoming interns across the country. Um, we'll see how the rest of the spring pans out, and then it's going to be interesting to do orientation. So, welcome to the specialty. This episode is really important and really timely for the beginning of a new academic year. And we're going to be talking about how to master effective patient-physician communication. And we are joined today by one of our esteemed colleagues, Dr. Jaime Roura, and I will let him introduce himself. Dr. Roura?
Thank you so much, Omar, for having me. And thank you, Avi, for inviting me for this podcast. Hello, everybody. I'm Jaime. I'm the first year fellow at UNC Reproductive Endocrinology and Fertility, and I look forward to sharing today about modeling professionalism.
Yeah, thank you so much for joining us on today's episode. I wanted to anchor this episode in professionalism. And so when we talk about what makes an effective patient-physician communication, it's one of the things that we expect trainees as well as attendings to do, but you know, we don't really get that consequential training per se when we are in residency or fellowship, but we're expected to execute it. So, looking up in the Oxford English Dictionary, if you were to look up what professionalism is, and I'm going to read directly from the Oxford English Dictionary. Yes, we use dictionaries still. Professionalism is defined as the competence or skill expected of a professional, whatever that means. It also says that it's the practice or the practicing of an activity like a sport or whatever by a professional, whatever that means. And then there's another definition that says it is consistently achieving high standards both in work and how you behave. So, Dr. Rohr, what would you say is your definition of professionalism?
Thanks so much, Omar. One of the same things that I struggle with defining professionalism is that a lot of these definitions go around and come back to being a professional. And I've seen throughout my career a lot of, mostly outside of medicine, but also in medicine, a lot of professionals that I feel like the treatment is not to that high standard. And for me, it's really that last one that you read where you're trying to achieve a behavior that is really very respectful, where you're in our field, you're offering a service to others while really making sure that the patient is feeling well taken care of. And when that service includes an interface with other coworkers, we're applying the same standards where everybody feels that they're taken care of and that we're respectfully carrying out our conversations and our interactions.
So high standards and respectful conversations are great, but what exactly do those mean? Like for me that those are very nebulous terms. Um, Dr. Shriba, what do you think is your definition of professionalism when you use it with either yourself or trainees?
Yeah, I think, our conversation so far reflects the challenge in pinning this down. I think for me, as granular as I can get, is that it's a code of conduct that adheres to three general values. And these values are pretty basic and pretty broad. And I will get into why I think it's important that they're a little broad, but values that adhere to good patient care, values that adhere to respectful engagement with your peers. And I think also what's important is that you're respectful and you adhere to the tenets of your healthcare system. And I think that these can look a little bit different in different patient populations, different practice settings. And I think that's important because professionalism and those standards of excellence can be adaptive. And it's a little bit subjective as to what that excellence looks like for one practice setting or one person from a background and one patient population. But that's sort of where I get started, Omar.
Cool, cool. I guess for me, I agree with what you both are saying regarding what the definition of professionalism may be. But I worry, as you had intimated earlier, is that, we are also having trouble defining exactly what professionalism is, even though we are quote unquote professionals, um, or we think that we are. Um, and I worry also that folks may have differing definitions of what professionalism is and use those not in the best of ways, especially when it comes to evaluating learners, evaluating faculty, holding faculty or learners to standards that they may not even be aware of. And, we could get into a whole big discussion about what is the hidden evaluation curriculum and things like that. And I can see how this may actually impact, particularly those that are coming into medicine from a minoritized background. And so it's really important that we understand exactly, or that, our listeners understand exactly when they are in a medical education space and they're talking about professionalism, that everyone agrees on a concrete definition of what that is. So I'll throw it out there. When it comes to professionalism, what is its role in medical education? Um, Abhi, what do you think?
Yeah, I think that, your point about, having very a shared view of what those elements are of kind of broader tenets is really important. And I think the role of professionalism in medical education is incredibly important because as you learn about medicine, if you're a medical student or resident or fellow, you're learning about, your craft, you're learning what you're interested in, but you're also learning about yourself, who you are and how you can serve in that role. And with any other job, if you go to a restaurant or, fast food chain, there's almost like a training of how that particular company, expects standards of behavior when you're interacting with customers. We don't necessarily have that in medical education, but it's hugely important, and if not the job itself. So the role of professionalism in medical education is to teach learners how they can channel who they are, and put that into what they're learning and what they want to do. I think the kind of core tenets as they do that is understanding and respecting, whether it's their patients, understanding and respecting their peers, and the system they practice in.
Yeah, I mean, we try to teach that when, students are in medical school with, little, pockets of how to talk to patients, how to interact with, attendings and nurses in medical school, but that really doesn't translate terribly well to when you are in the, residency or fellowship space. I don't know, Jaime, what has been your experience, or what is your thinking of what is the role of professionalism in medical education?
I agree with a lot of what Abhi said regarding that it may actually be one of the most important aspects of what we learn during our education and even past like our formal training, because a lot of the professionalism is going to come down, part of it is going to come down into integrity, but a lot of it is also going to come into play when we're communicating with our peers and with our patients. And being an effective communicator really helps in being able to convey exactly what we want our colleagues and our patients to know. And I look at it like a great aspect of the art of medicine. As a trainee, a lot of what we need to learn regards learning the basics of the medicine and having a foundation that really allows us to take adequate care. And that's one of the high standards that I was talking about earlier, where really we need to be offering good medicine to patients.
Yeah.
Now, to
Sorry, go ahead.
really go further than just offering good medicine, we have to be able to communicate it in a way where patients are able to understand and digest it. And I think that's one of the hardest things to learn in medicine because we're trying to translate a lot of knowledge into a verbiage that patients can understand and deliver it in a way that they can also digest it. And I think that's a huge component of that professionalism because organizing all the patient communication in a way where they're able to digest it and understand it, and you're able to recheck with them that they're receiving at least the most important information that you can. When I think when we do that, almost all the other aspects of professionalism have to come in check. There's a few others that are more in the back end, like following up with the patients, trying to, build a system that helps them be able to continue forward with their treatment and really be patient forward. But on our end, I think that's a huge aspect of it. And it really, I feel like the communication aspect really brings a lot of it together towards that professionalism and the art of medicine.
Mhm. And when we talk about effective communication also includes those conversations that are communicating bad news. Now,
Absolutely.
a patient may not like what you're saying and may lash out, may, exhibit behaviors that, for lack of a better word, that are unprofessional or unbecoming of anyone in a one-on-one conversation. But the importance of what we're talking about does not incorporate how a patient's reaction is to what you're saying. It's actually how you're saying that information, allowing the patient to then take on the response that they choose. And I think that's super important for our listeners to understand. Um, Even when we ourselves are our patients, when we go to the doctor or we are just having like regular conversations with someone, if we hear something that we don't like, we can choose how we respond to those conversations. So I wanted our listeners and I wanted to frame this conversation in that regard. Anyone have any thoughts about that?
Yeah, I think that's a great point because, as medical professionals, it the number of people you interact with on a daily basis, whether that's, people of the clinical care team, patients, administrators, it's seemingly endless. And I think, Omar, your point about sort of controlling what you can and controlling your methods and process of whether it's delivering difficult news to a patient or talking with an administrator or troubleshooting something in your clinical setting with your team. I think it actually helps to have very structured ways of approaching it because it's easy when you're well rested and not overwhelmed with your clinical volume to be a little bit more patient and compassionate and communicate differently than when you are a little bit more tired or at your patient's end. So I've actually found that sort of having these structured, ways of at least approaching, say, delivering bad news to patients is actually very helpful because you do anchor it to, controlling your way of presenting information in a respectful way. And then you can work with people with their reactions.
Jaime?
Completely agree with what Abby's saying. And delivering bad news, I think, is also an art that there are many frameworks that we can gain insight from in how we deliver the bad news. And I also think that we need a good way to think about patient responses is that it's part of the disease process, at least in what I do on a daily. So I work with a lot of infertility patients, and when you see our pregnancy rates, even in centers with really good pregnancy rates, we deliver a lot of bad news because our bad news tend to be negative pregnancy tests and miscarriages, and they can be real hard news on patients. and delivering it in a way where we can hold space for reactions that can be very emotional, and they can range in the whole gamut of our responses to our grief response. When we allow the patient to express themselves and when we can hold space for them and eventually circle back to validate that this is part of the disease process, and then that most patients respond in a way that is within the gamut, in a way that's not going to be dangerous for you or for them. So when we really allow them to express that, I think that that's very important, and then tie it back to continue the medical counseling regarding their process and what would be beneficial for them in a timely manner. And that timely manner may not be the same time we deliver the bad news, depending if they need time to process and then come back for more.
Yeah, totally. I think, we talk about the patient and those and how to understand and listen to a patient and actually hear them and understand exactly how their emotions may be impacting their reactions to news. But I think it's also important to understand how we, as communicators of information, are holding space to understand, are we doing that effectively? So as a medical education nerd, I have to always go back to the ACGME. And so the ACGME has many milestones for our learners and how they progress throughout their training. And one of the milestones is professionalism, and it has four specific components related to it. That includes professional behavior, accountability, self-awareness or conscientiousness, and recently added is well-being. Um, Jaime, what do you think of these components of this milestone, and how would you, as a current trainee, apply this to your practice, or how would you communicate this to a resident?
As a trainee, I think that this can really help. I mean, this really helps me in having a more holistic view of professionalism, both as a long-term aspect of my career, as a skill that we can develop, and also in a way that, like, how do I learn, like, the different aspects of it. So I really like that breakdown that the ACGME brings, because the professional behavior, I think we've been discussing a lot during today's episode. The accountability for me is super important, because if you're not accountable to yourself or to your team, then how are you going to grow in your skill, and how are you going to build that trust with everybody, including the patient, your coworkers, your boss? It doesn't matter who it is. So that accountability for me is key. The self-conscientiousness is that insight that we develop into our skills with the patient and with the colleagues, that I find is probably the last two are probably the hardest ones, because they're a lot more dependent on reflection. And as a trainee, the wellness aspect, especially during, I mean, both during residency and fellowship, at least for me, it's more true during residency, where I was less of a master of my time. Then how do you allow enough time for yourself to be able to be balanced, so that the other aspects of your being, including work and personal time, are a lot more, um, what's the word? So when you're well, you're going to be a lot better professional. And you're also, when you're not at work, you're also going to be allow better time for yourself.
Yeah, so I feel like when I take care of myself and I do things outside of medicine, I'm able to more effectively practice medicine when I'm at work. I remember when I was an intern, I said to myself, this is never going to be my life. I am never going to be consumed by this. I'm going to have a life outside of the hospital. I have carried that with me since day one, and it has been great. Now, do some people get mad at me if I have my fun and I enjoy things that have nothing to do with medicine? Sure. But, as the kids say, when people are mad at you, that's when you're succeeding. So it's great. Um, Avi, when you think of these professionalism milestones, how do you apply this as someone who's teaching fellows and residents? And, talk to me about your own feelings regarding this.
Sure. I think that these, and I'm sure that the board or the people coming up with these milestones encountered a lot of the challenges that we are in this conversation of just how to make this granular and, applicable to everybody who adheres to them. And I think that one of the reflections that I have of these kind of core values is how adaptable they are. And I think that that's something I try to think about, especially when working with trainees and medical students. I'll take, for example, we can kind of run down the list here of, you say, professional behavior. And one thing that I think a lot about is pre-COVID versus post-COVID. Just if you walked into, a physician's office, I think pre-COVID, we would be much more likely to see people just in what they wear, business casual or non-scrub attire. Post-COVID, for whatever reason, now FIGS is booming. It's very stylish to wear scrubs in the office, and I think that's an example that, probably there isn't a drop off in professional behavior, but it just looks different from one time to another. And I think similarly, if you go down this list, what awareness and conscientiousness, that process for one person can look very different for another, and as well as well-being. So I think ultimately what I think about for myself is if I was sitting, Omar, to go back to your point about if I was a patient or I was in the, room with a loved one who, the provider walks in, what do I want that feeling to be when I look at that provider? I want that person to be kind of at the top of their game, whatever that means, whether that's well rested, they just came off a weekend where they're doing things that, make them energize and focus on work, that this person is going to be accountable for whatever, comes from this visit and is going to take care of my loved one, and that they're going to be professional in their own skin, whatever that looks like. If that means, they're wearing scrubs or, a suit, whatever that looks like, that they can kind of maintain that professionalism and, sort of connection and responsibility to the patient. So that's how I kind of look at it for myself. But I think one thing that I like a lot is how adaptable all these things are. And if you look at how they change over time, you can really morph that into and present that to learners that, hey, whatever your personality is, your background, like you can do this. You're a professional. You just have to find your combination of things that look that way.
Yeah, and when we are teaching professionalism, it's really important, like with anything that we teach, that we concretely outline exactly how we are going to evaluate people based on whatever metric has been agreed upon by the collective, right? So the ACGME has this milestone, but if you were to read it, it's very nebulous in how you can interpret it, right? So multiple people can interpret the same phrase multiple ways. And so I think it's important that if we are going to evaluate a learner based on professional behavior, that we concretely define exactly what professional behavior is. It involves showing up on time. It involves closing your charts appropriately. It involves, having effective conversations with patients. And how do we evaluate that? I encourage everyone to do direct observation with their learners so that you can actually see how they are talking to people. Because, I can say that, Jane is doing like a very great job in the clinic, but her patients may say something totally different regarding how she interacts with them. So it's very important that we write these goals and objectives down at the beginnings of rotations and, you know, communicate that to our learners so that there's no question about what standards to which they are being held. And so I think this is important, and it gets into the idea of when a physician is with a patient and those conversations are not effective. What makes a conversation not effective, and how do we learn from those experiences? Abby?
So I think we've all seen ineffective conversations, and probably when you're for seeing it, it's hard to always identify what's making them ineffective. And I feel like it's always helpful to almost do kind of like a root cause analysis of where something went wrong. So, I think starting with what effective conversation or communication looks like, I think it's an appropriate setting or place, understanding what everybody in the room's role is. So if that's a patient and a provider, a physician and a nurse working, in the hospital or clinic, understanding their perception and their perspective of the situation, what they know, coming into that conversation, and almost like an invitation to sort of, communicate what you have in terms of knowledge, whether that's a difficult diagnosis or a sort of uh, a disagreement in clinical care plan with somebody on the team. Sort of an invitation to be able to say that, I think, is also important, because that not only recognizes where you may have a shared view or a shared perspective, but an invitation to understand that there's this room to grow or room to make a plan. Um, and then, ultimately sort of making sure that everyone is on the same page at the end of that conversation, that what has been communicated, that I felt like I was communicating, this person understood. And maybe I didn't do a good enough job of verbalizing it, and therefore they have not understood it. And then making a plan moving forward. So I think ultimately kind of like the setting, perception, information gathering and invitation, and then the transmission of knowledge. And then kind of not to use like a corporate term, but circling back and making sure that everyone's on the same page, not only with the information communicated, but where we're headed moving forward. Um, I found that to be kind of an effective, just sort of framework for myself when I think about my own interactions that haven't gone as smoothly as possible. It somewhere down that rubric, I can kind of identify where something went wrong.
Yeah. I mean, one of the things that I think is important when it comes to having effective conversations is role modeling. And basically, you as a teacher showing exactly your learners what it means to do something, because a learner may be exposed to a new aspect of a specialty, and they may take on how someone does things in their own independent practice. So talk to me about what role modeling is and why it's important for you.
So role modeling is a way where we essentially model or uh, will carry out the behaviors that we would like somebody else to learn when we're talking about the learner setting. And I think we also do modeling outside of the just the learner setting, and part of that professional communication with patients that we're talking is really um, you know talking the talk or walking the walk. So that would be the, I think, the good vernacular for the role modeling. The the way that I th- I think it's important for the learner, the role modeling is, as a learner, I want to see how different people go about their professional interactions, both with patients and with colleagues, partly because I want to know, what I think it's important to have some healthy skepticism around this. And that's going back to one of Abhi's point regarding like when you're I really like that framework that Abhi uses. And I like to be healthily skeptic when I'm thinking about, am I effectively communicating with my peers, colleagues, and patients? Because I don't know what obviously I don't know what I don't know. So trying to check that communication at the end is super important to see if I'm being effective, and going back to that milestone from earlier regarding having some self-conscientiousness and self-awareness. So being skeptic about my own self-awareness, I think, is important in trying to generate that introspection, self-feedback, and feedback from others. Now, when we're thinking about role modeling, as a learner, I want to learn from my attendings other communication styles because it can build on this own skepticism with myself in terms of like, what do other people employ in their behavior, in their professional behaviors that can make my own much more effective? Right? And what am I doing that's already effective that I should reinforce and continue carrying forward? So that is something that for me is huge. And I remember when I was a resident and had a very broad gamut of different techniques, much more than now because I was having many more attendings and seeing attendings that had a system that was really effective, that the patients left being a lot happier with the interaction and happier, not necessarily with their disease process, because my like the best role model I had, I feel, during residency was a gynec. So he was delivering a lot of difficult news for patients. But when patients left, they felt that they had gotten important information about their disease process. They left with a plan. They felt heard, and it was a whole team effort because the professionally the my attending's role modeling was built not just in his interaction, but he built it into the team interaction with the patient so that it really, like, patients left being heard, not being rushed in or out of their rooms, and really felt taken care of, and with the ability to come back if they had any doubts before proceeding with any form of diagnosis or treatment. And for me, that was huge because seeing, really feeling like if I'm on the other side of the table, if I'm the patient, I want to feel heard. I want to feel well taken care of. And I want to feel comfortable with the team so that, and with the treatment plan so that I can proceed down a path that I have no clue where it's going to take me, but that I know that I have a team that's going to have my back irrespective of the outcome. And I mean, I really think that that aspect of role modeling is huge. And when I have these role models that are really important, then I want to try to keep coming back to them because I want to learn more from that style, and then I want to implement and kind of do those like cycles where I go through my own application of them in my communications with colleagues and patients and see where I'm being more effective. I've really enjoyed that aspect of learning from my role models.
I think that's beautiful. So, you know, we as attendings are really always teaching, even if we're not verbally saying something, right? And so it's the way that we show up to the office, it's the way that we conduct our practice in terms of, how do we structure our visits? How do we document? How do we bill? How do we provide that comfort to patients when they need it? How do we effectively, put the humanity into medicine when we are inundated with so many protocols, guidelines, um, committee opinions, practice bulletins, what have you? Um, I think that's important. Abby?
Yeah, I think that it's, all this together is, what's I'm thinking about is that professional behavior, requires a lot of thoughtfulness and requires a lot of structure, not only for yourself, but your learners. And so I think, Jaime, your kind of, experience with that attending, I'm sure that person, while they had this natural way about them over time, sort of had a particular approach to, delivering difficult diagnoses and, how they went from one room to the next, and did that every day, every month for years and years and years. There's like a form that comes to that inherent compassion and that thoughtfulness. But I agree with you, Omar. It's sort of a modeling of professionalism. It's almost like there's somebody watching you at all times when you're in academic medicine. And, what we can do can really matter in terms of imprinting, behavior onto or professionalism onto a medical student, or, being a great part of a clinical care team. I don't want to kind of insinuate somebody is paying attention to us all the time, but it's sort of a heightened importance to how we comport ourselves.
I have loved this conversation that we've had today, but some of us have to go and see some patients, and our listeners are probably having to do the same. So, for those busy clinicians, what would you say is your med ed moment? Abby?
I guess I can go first. Yeah, I think that, sort of piggybacking on what I just said about the structure of, what professionalism looks like, I think defining, maybe you're a trainee listening to this, maybe you're an attending, sort of defining the specific components of, maybe one of those pillars of the ACGME professionalism, which were again professional behavior, accountability, self-awareness, and well-being, defining what that is to you or to your trainees, and being adaptable with what those, points are within that can help you not only in times where it's fast paced, difficult, you're overwhelmed, but also your trainees as they're trying to figure out their place in this professional medical world.
Jaime?
My med moment for this is, as a trainee, really try to find those role models that you can learn from and that you can emulate, and also use the tools available that help make a framework for the art of medicine that will develop that professionalism, that will really help you be a very efficient physician from the communication and the professional side. I love the committee opinion that ACOG has on the effective physician-patient communication. It really brings a nice framework for that art of medicine. And then implement it. Ask your attendings also to observe directly and observe them as well. Like, don't feel like all you have to do is active participation with the patient. You also want to take a step back and let your attending do some of the counseling and learn from the way they do it. So for me, I think that that's super important. It really helps to have a framework from a learning perspective, and that would be my meta moment.
Thank you both for sharing. I think my med ed moment is a gift that I want to leave all of our trainees and attendees. And just going into any patient interaction, just simply ask them at the beginning, what is the goal of today's visit for you? It makes your life 1,000 times easier. The patient feels like that they've had their questions answered. They feel like that the visit is actually meaningful. And you may actually find that, the conversations that you are going to have are going to flow much easier because the patient has received what they had been wanting to gain from that interaction. And that may allow you to communicate stuff to a patient that, they didn't even anticipate. So not necessarily blindsiding someone with information that is going to be devastating, but always anchoring it where the patient is, I think is going to make the most successful conversations. So I wanted to thank my guest today. Jaime, it's been awesome having this conversation with you, and Abe, a pleasure as always. Please continue to listen to this podcast, and our next episode is actually going to be our season finale of this wonderful podcast series. And enjoy spring. Thanks for listening. See you next time. Bye bye.